All right. Good afternoon, everyone. Thank you so much for joining us for our Wellness Wednesday. This is number two this will be the second one so far. A little introduction. My name is Kylie Wyeth, and I'm a health educator and also a health program coordinator with the Healthy Aging Association. And today we're going to focus on exercise and inactivity and how that affects falling and our risk of falling. All right. I'm going to try to keep looking at the waiting room as well, making sure that we can get everyone in on this awesome little program. All right. Moving on, first and foremost, this will be recorded. We will post it on our YouTube channel, our website, and our Facebook. So if you feel uncomfortable being recorded, please feel free to just turn off your camera and you won't be seen in the recording. So that's a little heads up on that. All right, moving on, a little bit about Healthy Aging Association. I do see a few new faces on here, so I'd love to welcome you and many that I recognize from our different classes. All right, with the Healthy Aging Association, we are a nonprofit organization whose mission is to help older Americans live longer, healthier, more independent lives by promoting increased physical activity and sound health and nutrition practices. So that's a little bit about us. And I just wanted to start with some startling statistics about falls related to older adults. A lot of people don't know too much of the facts, so I thought this was really important. Every 11 seconds, an older adult is treated in the emergency room for a fall, and every 19 minutes, an older adult actually passes away from a fall. 20% of those falls do result in injury, and falls are actually the leading cause of fatal injury and the most non-common, the most common non-fatal trauma related to hospital admissions amongst older adults. So some of those statistics are quite scary. So being able to be knowledgeable and know how to prevent a fall in all of the different categories is really important as well. And from this CDC little graph over here, the number one cause of, or falls are the number one cause of hip fractures in older adults. 1 in 4 older adults reported to have a fall. This is a little bit further back, but that was reported in 2014. And then 1 second an older adult, every second of every day, an older adult has a fall. So like I said, very scary, startling statistics that we need to take serious and make sure that we are taking precautions in our home, outside, mentally, physically, that we are really preparing and taking the precautions for falls. All right, and here is something else that I found from the CDC, which we already kind of talked about. The 1 in 4 reported a fall in 2014. But over here on the right-hand side, it says more than 7 million of those falls did require medical treatment, or they were at least restricted from activity for at least a day. And then also more than 27,000 older adults died as a result of falls. So that's 74 older adults every day. So like I said, very startling statistics that we definitely need to make sure that we're ahead of the game. All right, so today I want to talk a little bit about our main focus is going to be exercise and how exercise relates to fall prevention. But during this pandemic, inactivity has been a very popular trouble within a lot of people's lives. So inactivity is defined as participating in no activity beyond normal activities of your daily life. So you're not going out for that extra walk or doing that gardening that you normally don't do. So doing nothing beyond what you would do in a normal day, you would be considered inactive. And so what happens when we are inactive? Our health and our overall quality of life decreases. Obviously, our strength and stamina decreases. If you're not exercising, even going for that walk, it can actually really take a big toll on your body. Inactivity can also increase depression. If you isolate yourself or you're not getting that socialization that you need, even picking up that phone, a FaceTime call, anything like that. And inactivity increases risk of obesity. It is potentially can increase your blood pressure, and it also increases your risks of heart disease, and also certain cancers can increase with inactivity. So physical activity increases healthcare costs. So 4 in 5 of the most costly chronic conditions among 50-year-olds and older can be prevented or managed actually with physical activity. So physical activity plays a very big part in our life, whether you like to believe it or not, regarding to falls, health, everything. Even if your physical activity is gardening or going for a walk, it definitely makes a huge difference in your life. So I'm sure many of you have experienced inactivity at some point in this pandemic. Maybe it was early on, maybe early on you were exercising, but it was hard to find that motivation. So I'm sure many of you have experienced it throughout this pandemic. I know things are starting to open back up. We're getting a little bit more freedom. So hopefully we become back to normal and very active. So how has inactivity increased due to the pandemic? So physical activity in the older adults has decreased due to COVID-19 because obviously we're all trying to avoid it, right? So gyms, group exercise, they were all closed. Even our Young at Heart class was closed due to the pandemic. So now we are stuck at home and trying to find that motivation to either pull out our loops and tubes or pick up those free weights, and finding that self-motivation rather than knowing that you're going to go to class and see your friends and different things like that. So an organization like us kind of found ourselves as we need to take care of our older adults, make sure they're holding themselves accountable. So that is why we created our Zoom classes. But some people don't have access to a computer. They don't have access to internet. They don't even, maybe they have a computer, but they don't even know how to use it. So not having that technology to even participate in the Zoom classes definitely increased some older adults' inactivity. So as a consequence, physical and mental health in older adults was negatively affected during the confinement that the pandemic caused. All right, so talking all about inactivity, we want to talk about why is movement so important. So by moving, we are strengthening our muscles, which improve our stability, our balance, and our coordination. Exercise also improves our blood pressure, especially with those with hypertension. Those who exercise actually do experience less pain and better joint function. So staying active, as you can tell, is the right thing to do. And then movement also allows you to keep your independence. So you can stay strong while you age, and it keeps you doing the things that you could normally do alone. Rather, if you become inactive, you will lose a lot of your strength, stability, your balance, your coordination, and you may need to ask for help on tasks that you have always been able to do by yourself. So keeping your independence is, I think, a big one in this. All right, so what do we consider movement? Like I said, there's many different ways to get moving. Even if you go for a brisk walk, or maybe you don't walk at all. So even going for a slow walk is considered movement for you. You can do aerobics, even your yard work and your gardening. If you don't do that daily, then that is definitely an exercise for you, and it is definitely movement. Getting that body moving, warmed up, stretching those joints and muscles. You can also participate in yoga, using resistance bands. You can do dancing, Tai Chi, free weights. The list can go on and on. Honestly, I could just type them all out here, but we'll stop there. And then older adults should include stretching and balance activities as part of their weekly physical activity. Stretching out those muscles that you work out and really focusing on your balance. As we get older, that balance and coordination can decrease if we're not working on it consistently. So I would definitely recommend practicing your balance and stretching after getting moving. All right, talking a little bit about strength training that I had mentioned in the last slide. All right, sorry, let me move this over here. All right, so why is strength training important? So regular strength training can improve and prevent muscle loss. Obviously, those bands have a resistance on it. So if you're moving up in resistance or just even practicing a few times a week, you are definitely building muscle and preventing muscle loss. It also improves our balance, strength, flexibility, and coordination. It actually decreases our risk of falling. So if our balance is better, if we're stronger, we have better coordination. Those are all things that affect having a fall or can affect having a fall. So really focusing on those areas definitely decreases the risk of falling. And like I said before, it helps maintain that independence. So we want to keep doing what we're doing by ourselves, the best that we can. So strength training really is important to maintain that independence. All right, so I want to show you a little bit about what the Healthy Aging Association is offering to our older adults within our community. We have a Young at Heart strength training class. It is a practice test intervention. So we use a rubber resistance tubing. It has nice and soft handles, and we have 4 different levels of resistance. Right now, due to the pandemic, classes are held virtually, as you can see in that top photo. That's one of our volunteers teaching her Zoom class. We are working on slowly reopening these classes at the moment. So we're hoping to be back in class and seeing everyone's beautiful face and socializing. Typically, these classes meet for an hour long, and it's usually 2 to 3 times a week. We do like a day of rest in between each day. And our Young at Heart works on strength, balance, flexibility to help reduce the risk of falling and maintain independence. So this is an awesome program. We still currently do have those Zoom classes, but we are hopefully going to be opening up those in-person classes fairly soon. All right, moving on, another great exercise that you can try for yourself is our Tai Chi for arthritis and fall prevention. So our Tai Chi class works through improving balance, confidence, and muscular strength. So right now, our class meets again on Zoom due to the pandemic. We meet on Tuesday and Thursday mornings from 11 a.m. to noon. And again, we are working on getting this in person as well and not on Zoom. So if you are interested in our Tai Chi or our Young at Heart class, please feel free to give our office a call. I can put our number in the chat box and we can get you signed up for that, and you'll be preventing falls weekly. All right, so if we're new to exercise and moving, some tips for starting an exercise program. We would highly recommend checking with your healthcare provider prior to starting an exercise program. Making sure you're getting the right approval and making sure you're staying safe is very important. And then finding a class that you enjoy. That will make you have self-motivation to get to class every day if you enjoy going. And also another tip is ease into exercise. So say that in class, everyone is doing 12 repetitions, but it's your first time. It's okay to maybe only do 4, 5, or 6 repetitions. Only do what you can. Really listening to your body is really important. You don't want to overdo it and cause tension or pain, and then that will make you not want to go back or not want to keep moving. And another tip would just be trying to stay active wherever possible. So park as far away from the entrance as you can. If you're at home watching TV, get moving while those commercials are going. Maybe you could take a little lap around your house, just march in place, anything to move pretty much. And then also we recommend starting and ending your day with a walk. Right now with the hot weather, I know it's a little hard. Maybe getting up early and getting your walk in then would be the best idea during this heat. All right, so talking a little bit about walking, why is walking so important? It can lower our risk of health problems like high blood pressure, heart disease, and diabetes. Walking can lead to losing weight. It can also actually slow mental decline and lower the risk of Alzheimer's disease. It can enhance our overall mood and attitude, improve circulation and sleep, and strengthen your bones and muscles. And once again, it can help prevent falls. All right, so some tips for walking. We have our volunteer Peggy over here. She is actually a Young at Heart instructor, so she is out walking, enjoying the sunshine. She is wearing those good supportive shoes that secure her ankle. You can bring your cane or your walker along the route with you to make sure that you are stable and safe. Definitely recommend bringing that water bottle to stay hydrated at all times. And then of course, dress appropriately. Make sure if it's hot, we're wearing sunscreen, protecting our skin, and wearing comfortable clothes. So those are some tips for walking. And like I said, we consider that movement, that is exercise, and it helps prevent falls. All right, so we here at the Healthy Aging Association, we offer a Young at Heart, call it our STEPS program. So it's seniors tracking exercise in perfect strides. And we have 2 challenges a year. They are 12 weeks. In fall, this one's coming up. It's August 9th through October 31st. And then our spring of 2022 will be February 28th through May 22nd. And a little bit about this program is you sign up and you will receive weekly motivational emails from our staff, encouraging you to walk, asking you your goals, where you want to be, and different updates like that. And then every 4 weeks of the challenge, you will report those miles that you walked to us, and we will go ahead and note that down. And then if you report your miles, you will qualify to enter a raffle during that 4th week. And we also will give you an invitation. Through COVID, we had to do a drive-through distribution brunch, but we do hope to get back to where we can do a big brunch all together to celebrate all of our walkers. And again, if you're interested in any of these programs, they are really awesome. Just give our office a call and we can get you signed up for anything. All right, so how does inactivity increase your chances of falling? So if we are inactive, it will weaken our muscles, which will lead to falling. It will weaken our bones, which we've mentioned, which will lead to falling. If your bones are not strong, the falls can happen very, very easily. And inactivity will also affect your balance, which could lead to falling. All right, so as we age, most of us lose some coordination, flexibility, and balance. This primarily happens through inactivity, which makes it easier to fall. So researchers show that just 30 minutes a day of activity can help decrease your risk of falling. So really just trying to get moving for that 30 minutes, do your strength training for at least 30 minutes, go for that 30-minute walk, anything to get moving and stay strong. All right, so some different ways of preventing falls. As we talked about today, exercise regularly. Get your vision and hearing checked annually. Check your home for fall hazards. Use assistive device like those canes and walkers. They will help maintain your stability. Watch out for your pets. Watch your surroundings outdoors, such as those cracks, wet sidewalks, anything like that. And medications, really managing those, knowing the side effects, as we talked in our last Wellness Wednesday. If you missed that, it will, or it is already on our website, so you can go back and watch that video. We had our guest speaker, Dr. Bob, really going in depth about medications and side effects and the risks of falling. And then last but not least, invest in yourself. Join one of these fall prevention programs. They are proven to prevent falls and keep you nice and strong. All right, so a little overview of what we offer for our fall prevention is our Young at Heart strength training class, our Tai Chi for arthritis and fall prevention. We offer a Matter of Balance, Young at Heart steps, and our Dignity at Home fall prevention program. So I haven't talked about the Matter of Balance yet, but it is an evidence-based program designed to reduce the fear of falling and increase the activity level in older adults who have concerns about falling. So through this class, you will learn to view falls and the fear is falling as controllable. You're able to set realistic goals, learn to change the behavior environment, hear from others in your small group, about 8 to 12 people, hear other stories and how they can impact you. Right now, we don't have any of these classes going. We just finished one on Zoom and we are hoping to return in person for our next round. So you can give our office a call for that and we can put your name down if you're interested. All right, in our Dignity at Home Fall Prevention Program. So this program provides an in-home assessment, fall prevention education, and injury prevention accessories to qualifying individuals 60 and older or persons with disabilities who are at risk of falling in Stanislaus County. All right, so here are the program guidelines a little bit. You must be 60 years of age or disabled, be at risk of falling or have recently had a fall, fully vaccinated, and the income guidelines for just one person are up on the screen, and you can call our office if you have more people in your home and you want to get those income guidelines to see if you qualify. To get started, all you have to do is call the senior information line and you'll get pre-screened. And then the Dignity at Home program coordinator will reach out to you once they receive your referral. And just to better explain this, these are things like grab bars, shower chairs, handheld showers. We're checking everything from your smoke alarm. Do you have night lights? Giving you that education that you may need at the end of the home assessment. Spending time with the client, reviewing all of the fall prevention information. So this is really a great program. Even if you might not need it yourself, at least now you know it's in our community and available for even your friends and family. All right, so a little bit of summary now that I've been talking the whole time. 5 reasons to exercise. So it improves our quality of life and helps maintain our independence. It keeps our bones strong, helps prevent falls. Exercise boosts our energy, and it promotes better sleep. And again, a little overview of the programs that we offer here are Young at Heart, Tai Chi for arthritis and fall prevention, A Matter of Balance, Young at Heart, Steps, and our Dignity at Home fall prevention program. So all of these programs we offer deal with fall prevention and exercise as well. So if you're interested in any of these classes, please give our office a call. It's right here on the screen, 209-525-4670, or you can even email us up here at healthy.aging2000@gmail.com. All right, so talking about our next Wellness Wednesday, it's going to be July 28th at 11 a.m. Again on Zoom, and our next topic will be discussing vision and hearing. And like I said, every other Wellness Wednesday, we will have our guest speaker, Dr. Bob McGrew. So he will be here at the next Wellness Wednesday, really taking over, talking about the vision and hearing, because he is an expert in that. So I really encourage everyone to join that. Like I said, this will be recorded, so you can find it on our Facebook website or our website, YouTube, if you would like to rewatch it or see past Wellness Wednesdays. All right, and I just want to say thank you to everyone that has joined us today. I would love to ask you to unmute yourself if you have any questions at all. Feel free to ask questions, just chat a little. We do have a little bit of